All right, let's get into the female reproductive system and pregnancy. So we're going to start with some anatomy, a little bit of orientation so that you can know where everything is before we get into the meat of the discussion. So this is the external anatomy of the female reproductive system. You have the mons pubis here, and remember when we were talking in the male reproductive system about the perineum? Well, the perineum is this space right here. Of course, both males and females have it, but I just wanted to point that out so that you can actually see what we were talking about in that. Here you have the clitoris, which is the female organ that is analogous to the male penis. You have the labia majora on the outside, the labia minora or minis. Here it says minis and majus. It's often described as the minora and majora, but this is basically labia means lip. So you have the larger lips here, the major, and the minor or smaller lips there. You have the urethral opening. So this is the pee hole, basically. And then you have the vaginal hole here, or orifice, which basically means opening. And you have the hymen. So we'll talk about the hymen a little bit later. And the anus. So this is a little bit of a sidebar. When I am talking about female anatomy versus male anatomy, talking to young girls and young women about anatomy, menstrual cycles, etc. One of the things that I absolutely have to say, because a lot of people do not realize this, especially young ladies who don't look at their own anatomy, is girls have 3 holes, boys have 2. So if you remember when we were talking about the male reproductive system, they don't have an opening for sex and one for urination. It all comes out the same hole, the urethra that goes through the penis. So that is why boys have 2 holes and girls have 3, because the urethra is separate in the female from the vagina, whereas in the males it is all one. So again, girls have 3 holes, boys have 2. So let's see, did I finish talking about this? The external anatomy of the woman is not called the vagina. It is actually called the vulva. So from here out, you should be using the term correctly. Vulva is the name for the external genitalia of a female. The vagina is what is on the inside. All right, so in here is the vagina. This is the muscular tube that receives the penis during intercourse. All right, so vagina is internal, vulva is external. Even though we use the terms interchangeably and when we're talking to lay people, they are not the same. So when you're speaking to each other, when you're speaking to medical professionals, make sure that you're using the correct terminology. So when you're looking at internal anatomy, starting from the posterior end, moving anterior, you have your vagina that leads into the cervix. So the word cervix means neck. So this is sort of the neck of the uterine opening, right? So you have cervix here. If you remember correctly, that we had cervical vertebrae. These were the vertebrae in the neck. So just remember that term means neck. So this is the cervical os. So os is the name for the opening. This os leads into the uterus. This is the uterus that will house and grow a baby if and when she becomes pregnant. If you keep going superior, then you will see that this top part of the uterus is called the fundus. This is the body of the uterus. This on either side, laterally on either side of the uterus, you have the uterine tube, also known as the fallopian tube. And there are these finger-like projections on the ends of the uterine tube called fimbriae. Fimbriae are the finger-like projections, and they sort of cover the ovary. They cover the ovary like so, so that when she releases an egg from the ovary, those fingers sort of help to guide the egg into the fallopian tube, and then it travels eventually into the uterus. If it is fertilized, it'll be fertilized in the uterus, I'm sorry, in the fallopian tube. And as it's being fertilized, it will continue to move out of the fallopian tube, and then it will attach somewhere in the uterus, somewhere in the uterus. All right. You have the endometrium. So the endometrium will, again, all of this we'll talk about a little bit later, but the endometrium is the lining of the inside lining of the uterus that sheds every month when you have your menstrual bleeding. So this is important to know about, is the endometrial lining of the uterus, endometrium. Now, superficial to that, you will have the myometrium. This is, remember, myo means muscle. So this is the muscular layer of the uterus. And this helps your body to expel whatever is in the uterus. So when you have uterine contractions, these are the muscles that are contracting to help push whatever out, whatever is in there out. So if that's a baby, push the baby out. If it is the uterine lining, it can help to remove the uterine lining, help to kind of force it out. All right. You have a bunch of uterine arteries and veins that will bring blood to the uterus and remove blood from the uterus. Ovarian arteries and veins that will feed the ovaries, and a bunch of ligaments like this round ligament, this ovarian ligament, this broad ligament. There are several ligaments that will help to hold structures in place, like the ovary with the ovarian ligament, like the round ligament and the broad ligament. All right. Perimetrium, peri, of course, means around. So the perimetrium is the lining around the uterus, on the outside of the uterus. Endometrium, perimetrium, myometrium, those terms now should be self-explanatory. The parts of the fallopian tubes, you have the isthmus, the ampulla, and the infundibulum. And then on the end, you have the finger-like projections of the fimbriae. Let's see. So this is the isthmus of the fallopian tube. You also have an isthmus of the uterus. Make sure that you are looking up the word isthmus so that you can understand what that word means, and you can understand how it applies to both the uterus and the fallopian tubes. We talked about the cervical os. Here is an internal os here inside of the uterus. So you have the cervical os and the internal os. And this is the cervical canal. So the cervix is not like a flat disc. It actually has some depth. And so you will have a bit of a canal that leads from the outside of the cervix and deeper into the cervix and eventually into the uterus. All right, so those are the main parts of the female internal anatomy. Make sure that you are looking at this more closely so that you can understand everything as we go through the PowerPoint. Looking at the organs from the lateral view, you will see, to start off with structures that we already know, you have the large intestines here. So this is probably the transverse colon. And then you have the descending colon that eventually becomes the rectum. And then the anus, which is the actual opening where feces will leave. That is in the posterior end of the pelvic cavity, the abdominal pelvic cavity. Anterior to that, you have the uterus. So the uterus sits superior to the urinary bladder. Remember that when she's pregnant, this Uterus will grow. It'll take up the entirety of the abdominal cavity as baby is growing. And this is why moms will often have to urinate more frequently, because you now have this little person who is literally dancing and tap dancing and stepping on the bladder. So she doesn't have as much space in her bladder to hold urine. She does not have the capacity to hold it when there's somebody actually stepping on it and pressing on it, because that will push, literally push the contents out. So this is, again, why mom has a hard time holding urine, has to go to the bathroom more frequently. And so inferior and anterior to the uterus, you do have the bladder, and you can see the urethral opening is to the anterior. The vaginal opening is more midline or in the middle, and then you have the anal opening to the posterior end. Let's see what else. So here on either side of the uterus, you will have the ovaries, and then you'll have the oviduct or fallopian tubes. These are the little fimbriae, the finger-like projections that will help to guide the egg once it's released out of that space and into the fallopian tube, and will eventually lead it into the uterus. This is the pubic symphysis, so part of the pubic girdle, just to, again, give you a little bit more orientation. You can see that the bladder is very much posterior to the pubic symphysis. So this is why you often will not notice your bladder unless your bladder is full, and then the bladder can expand, and you can sometimes feel it if you palpate your lower abdomen or upper pubic area. You can sometimes feel the full bladder. All right, so there's that. And then from the anterior view, again, you have the vagina, which is the internal portion. The cervix is here, which the cervical os is the opening. Cervical canal opens to the uterus. You have the oviduct or fallopian tube with the fimbriae that work, that are surrounding the ovaries, that help to bring the released egg from the ovary into the oviduct or fallopian tube and into the uterus. So again, remember we were talking about the ligaments. There are lots of ligaments that will help your body keep things in place. You have your broad ligament, the round ligament, the ovarian ligament. Those will be the most important ones, but do know that you also have others. Uterosacral ligament. I'm going to allow you to guess what that one does. Broad, round, and the cardinal ligament. All right, suspensory ligament. So lots of ligaments holding things in place. Now, if you have a prolapse, and this is going farther, just going advancing before we get to that part, but because we've talked about it in previous lectures, I figured we can mention it here. But when you have a prolapse is when an organ no longer can hold itself in its place, and it can start to come out of the body. So a uterine prolapse occurs when these ligaments don't support the uterus and hold it in place well enough. So gravity will actually help bring this organ down, 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 and you can actually start to see the cervix in the vagina. And if the prolapse is deep enough or extensive enough, you can actually see the cervix on the outside of the body. It goes through the entirety of the vagina, and it'll start to exit the vagina, and you can see it outside of the body. So that is what a prolapse is. That's part of the reason why we have prolapses, is because of the ligaments are more lax, not able to hold it up, but there's also some musculature that we'll talk about a little bit later that supports everything and keeps it in place. This is another image that shows the same things. So ovaries, fimbriae of the fallopian tubes, uterus, the cervix, cervical os, cervical canal, internal os, uterus, myometrium, endometrium, parametrium, vagina, broad ligament. This is a broad ligament because it's broad. It covers a large amount of this space. And then you have the round ligament that is found there. So let's talk about puberty. So we already talked about puberty in young men. We finished the male reproductive system. Remember, we said that puberty for females can begin as early as 8 years old, between 8 and 10 for girls in the US. It can go a little bit longer. There are girls who will have their menstrual cycle closer to age 13, but lately in the last several decades, the age of puberty has gotten earlier and earlier. And so now we see more young girls entering into puberty between 8 and 10 years old. Puberty is triggered by the rise in GnRH levels. Remember, GnRH is gonadotropin releasing hormone. So these stimulate the gonadotropin releasing hormone will stimulate the anterior pituitary, that master gland, to secrete FSH and LH. Remember, again, FSH and LH are also found in men, but their job is a little bit different, of course, because the anatomy is different. So FSH, the letters FSH stands for follicle stimulating hormone, and in females, it actually stimulates the ovarian follicles to begin secreting estrogen, progesterone, inhibin, and a small amount of androgen or testosterone. So this is FSH in females. Again, remember to go back to males so that you can compare how the FSH differs in males and females. Then you have your estrogens. There are more than one. So when we talk about estrogen in general, we're talking about estradiol, that is E2. Remember, di means two. There are three estrogens, three primary types of estrogen, but estradiol is the most abundant. Estriol, think of tri meaning three. This is E3. So this is the one that is seen in pregnancy, and estrone, O-N-E, 1 is E1. This is the estrogen that you see in children prior to puberty. So up until the time of puberty, estrone or E1 is the one that is being produced primarily by the adrenal glands. And then once she starts going through puberty, the ovaries will take over the production of estrogen and will produce this estradiol, E2. This will last until she goes into menopause, where she will then, I believe she goes back to producing estrone, but she's still producing a small amount of estradiol. And then estriol is the version of estrogen that is produced during pregnancy. All right, so estriol is produced during pregnancy. So this is E2, E3, and E1. So when estradiol is stimulated during puberty, lots of changes are occurring. Remember, this is a slightly different type of estrogen that is produced versus what's produced prior to puberty, because that's E1. So E2 estradiol will help to stimulate vaginal metaplasia. Make sure you're looking up the word metaplasia so that you can understand what it's doing. It stimulates the growth of the ovaries and the secondary sex organs so that she can start to develop the eggs and she can start to look more like what we understand as the look of an adult female. It will stimulate growth hormone secretion. Growth hormone will then help her to grow taller and will increase the width of her hips. It will stimulate fat deposits in ways that are more feminine or that are more like female deposition. You have more fat deposit in the breast and in the hips, and that gives her the beginning of those womanly curves. And it also helps to thicken her skin. all right, so that her skin is thicker, but it is still thinner and softer and warmer than boys' skin. All right, so skin does get thicker, but it's still not as thick as boys. She's also producing progesterone. Progesterone acts on the uterus in preparing for what could potentially be a pregnancy. You see an increase in progesterone in the second half of the menstrual cycle. All right, so progesterone is increased in production during puberty, and this will act to help prepare the uterus for a possible pregnancy. It also has other jobs in the body, but this is the one that we're going to mainly focus on for now. Your estrogens and your progesterone will suppress FSH and LH secretion through negative feedback. So when you have low levels of estrogen and progesterone, the FSH and LH levels will increase. And when estrogen and progesterone increase, that feedback will tell FSH and LH levels to stop or to decrease. Inhibin will also selectively suppress FSH secretion. And know that all of the hormones that she is producing are cyclical. So they will rise and fall during certain times of her menstrual cycle. So climacteric and menopause. Remember, climacteric is considered that point that is midlife, and it is when the hormone secretions will change. In males, the climacteric is called or accompanied by andropause. In females, it's accompanied by menopause, and menopause is the cessation of menstruation, when menstrual cycles stop. All right, so climacteric is that change of the hormones. Menopause is when the menstrual cycle stops. A female is born with about 2 million eggs, 2 million eggs at the time she's born. All right, 2 million eggs at the time she's born. When she is beginning climacteric or the midlife hormone changes, there are about 1,000 follicles left. So she goes through many of the follicles. Obviously, she's not having like 2 million menstrual cycles. There are, multiple eggs that can be released at a time. Some of those eggs will degenerate, and some will mature and get ready to be fertilized, potentially. The follicles become less responsive to gonadotropins as she gets older and starts to have these midlife hormone changes. She'll then secrete less estrogens and less progesterone. Her uterus, vagina, and breast will begin to atrophy. Intercourse may become more uncomfortable because she has this atrophying of the vagina, and there can be less lubrication in the vagina. So that's why it can become more uncomfortable. It's possible to have more vaginal infections because there's less of the lubrication and all that goes on with the mucus and lubrication to help to not only lubricate the area, but also to protect it from invaders. And her skin becomes thinner or can become thinner. Cholesterol levels will also rise, which will in turn potentially increase the risk of cardiovascular disease. As we talked about previously, cholesterol is absolutely necessary in the body. We cannot live if we completely get rid of cholesterol. Cholesterol is the backbone of your hormones. So your estrogen, progesterone, testosterone, these are made from a cholesterol backbone. So as her hormones begin to decrease, her estrogen and progesterone begin to decrease, cholesterol levels begin to rise because you're not using as much cholesterol to actually make these hormones. And your body is like, we must need more raw materials to make hormones because we're decreased in estrogen and progesterone. So this cholesterol level rise, it makes sense as she is going through climacteric and menopause. Her bone mass also declines, which will increase her risk of osteoporosis. And part of the reason is because estrogen has a protective and building effect in the body. So estrogen, as estrogen declines, her bone mass can eventually begin to decline. Her blood vessels will constrict and dilate in response to shifting hormone balance. So this can cause hot flashes, which is the spreading sense of heat from the abdomen, the chest cavity or thorax, the neck, and the face. All right, so this is a dilation of blood vessels that can occur that will release heat and as a flash. Hormone replacement therapy is one of the treatments that is used for climacteric and menopause. You're basically giving the body hormones that are beginning to be low, so you can give estrogens and progesterone to help relieve some of those symptoms. And there are risks and benefits to both. That is a constant debate in medicine. How much to give? Is it going to be a problem? Do the risks outweigh the benefits, or do the benefits outweigh the risks? There's a lot of discussion, but just know that hormone replacement therapy is when you are giving hormones to help replace those that are declining. Hormone replacement therapy is generally different from birth control. Birth control is the same idea, that you're giving hormones for a reason, but usually, from what I understand, hormones given at HRT are lower than hormones, used in birth control therapy. So both of them are types of hormone replacement or hormone therapy. One is a replacement and one is basically trying to override the system. So as I mentioned, menopause is when you cease having menstrual cycles. This usually occurs when a woman is somewhere between 45 and 55. It can be a little bit earlier, so she can have menopause in her 30s. It can occur a little bit later. If she has early menopause is when you have menopause and menopausal symptoms prior to age 45. But as this says, the age of menopause has actually increased in the last century. So women are becoming older before their menstrual cycles stop. Now, there is a difference between menopause and perimenopause. So you may have heard the term perimenopause. If you haven't, that's okay. Perimenopause is the stage before actual menopause. So menopause, the official definition of menopause, is not only when the menstrual cycles stop, but once she has had no menstrual cycle for a year. So let's say her last menstrual period is January of 2020, right? So she had a menstrual cycle January 2020, and she did not have another one. Then January 2021, she'll officially be in menopause. Whereas prior to that, anytime between January 2020 and December 2020, she is in what's considered perimenopause. But after that, menopause. All right, we're going to start the sexual cycle in the next video.